We shall start. Good evening to my Indian friends and good afternoon to the friends abroad. This is my third session of DOBARA, focusing on dental education. And this is a session which we talk about the aging mouth. As you all, most of the members who are attending are senior citizens, aging individuals, and I would like to welcome all of them on board. And it is a big opportunity given to me by DOBARA, for which I am thankful to DOBARA, being a non-profit organization who is giving us a support and an opportunity as a dentist to give my input and help you all to understand the importance of mouth as age increases and what best can you do to maintain a good mouth, a good hygiene, and a healthy body. This is Dr.Ashank Mishra from Dental Hyderabad. Now, aging is as an accumulation of changes which happens over time, and aging in humans is a multi-dimensional process. As I said, it is a multi-dimensional process, and like any tissue in the human body, even dental tissues, as I'm talking about dental, enamel, dentine, gums, everything also undergoes changes from time to time, or eventually as aging happens, even dental tissues also get aging, and there are changes what are seen during the aging process. See, of a most important added concern here is, why are we so much interested into aging and dental diseases? Why? Because as age progresses, there is something which is added up to it, which is the presence of systemic disease. That means other medical conditions add up to your existing conditions. Patients may land up into sensitivity. Patients may land up into root canal thing. Am I not clear?
Your audio is going in and out. It's a little patchy.
Okay. Not very clear, right? Okay, let me just see one. Now is it okay?
Can you say a bit more?
Okay. Now is my audio okay?
It's literally going like you're going far and near. It's like going in and out.
Now how is it? Now is it okay?
Yeah.
Perfectly fine?
Yeah.
Okay. Yeah, so as I was saying, that the most important consideration when we are dealing with aging individuals is medication. Most of us, as the age increases, most of us are taking up medication. Someone takes medication for hypertension, for diabetes, for osteoporosis, for spondylitis, for rheumatoid issues, for cardiac issues, so many things, right? So as there are so many medications which we all are taking, we have to also consider the importance of medications and their interactions before we plan out any type of dental treatment. Most of your side effects, what you're seeing in your mouth, are a complication or a side effect of the medication. They are medication side effects which causes dryness of mouth, which is very, very important. There are a lot of side effects of medications which cause suppression of the immunity, so you start getting fungal infections in your mouth. So there are so many side effects, and most important, the people who are on a group of drugs called as bisphosphonates, maybe people who are suffering from osteoporosis or rheumatoid arthritis, and those people, doctors advise them a group of drugs called as bisphosphonates. And you all know that bisphosphonates, when they're taken on a longer span of time and when we give them in injection form, there are chances of the patients landing up into necrosis, or means a problem of the jaws when we plan any surgical intervention. So there are a lot of medications, there are a lot of medical conditions which has to be considered when we are planning the treatment for elderly individuals. Okay. Now, this is the specialty of dentistry, which is called as geriatric dentistry. So, geriatric dentistry is a branch of dentistry that emphasizes dental care for elderly population and focuses upon patients with chronic physiological, psychological, and morbid conditions. As I said, geriatric dentistry is a specialized dentistry dealing with individuals who are having dental care in a particular point of time, a particular age group, considering the systemic health, that means their overall health, and also considering their medical conditions, their medications, their drug history, and previous dental history. Considering all these aspects, I would like to cater the elderly individuals to this presentation so that whatever myths or whatever oral hygiene tips I can give, I would like to give across this presentation. So these changes which are seen in the oral cavity or in the oral tissues could be in teeth, could be in gums, could be in your saliva, could be in your taste. Deglutition is swallowing, and TMJ is your joint, as I mentioned. The TMJ means the joint where your lower jaw is attached to your head, right? That is called as the temporomandibular joint. So these are the changes which are seen according to the age, and we will look into one by one individually and address to them. The first thing is the change what you see, which is based upon the appearance. So as the age progresses, something what you notice is the sunken cheeks. You see that the cheeks get sunk inside, you get sagging, you get the nape. This is what you can see in the picture is the nasolabial folds what you see, and this is what happens with aging. Now, this happens eventually with aging, but then mind you, if in a younger age also, if you don't go for a replacement of teeth, you look more older because you don't replace your tooth. Because what happens is the fullness of your lip and the fullness of your cheek, the fullness falls down and your appearance becomes more saggy. So this is what happens in a cosmetic purpose way, when there will be these type of changes which happen on the aging. Next is resorbed ridges. With the age, eventually, now see, you can see the condition where the individual has lost all the teeth. So what is there in the jaw is what happens is the same when the newborn is born. What happens is the gum pad. Only gums are there. So if you don't get the replacement of the teeth, what happens eventually is the ridges on which we are going to place the denture, those ridges become narrow. You can see in the picture that the ridge what you have becomes very, very narrow, thin down, so that there is no place for the denture to be kept, and then the frequent problem of lack of retention comes. So that is why whenever you lose your teeth, you have to make sure that you get them replaced before your bone inside, your gums becomes resorbed, thin down, so that there is no opportunity for us to place a good denture, a simple conventional denture without doing any advanced technology. There are options to place or give you fixed teeth in these conditions also, but that becomes surgical because we have to advise you implant. So ridging, the ridges what are there, they get resorbed, and then we need to plan the treatment so that the dentures are given, the ridges are good enough and they have a good support. I hope you understand that the basement, if the base is not strong and the width is not there, it will be difficult for us to give you a denture which is going to sit on that. Okay, so that is why resorbed ridges, the most common problem happens when you don't get the replacement of your teeth or don't get your dentures replaced as soon as you lose your teeth. One more thing what you will face is XEROSTOMIA, which is commonly called as a dry mouth. As aging, what happens is your glands which makes your saliva, which is called as salivary glands, which are present. These glands, what happens is they get atrophied, and what happens is the amount of salivary secretion decreases and you start feeling dry mouth. You start feeling that you are getting dry mouth, you are getting soapy saliva, your lips are getting, when the moment you are maybe talking or something like that, you feel that they become dry, they get stick to each other, and you feel that there is something wrong in your mouth, which is called as a dry mouth. And then you can also see on the tongue surface that your tongue gets a lot of fissures. So there will be deepening of the fissures, what you will see. So what is the complication of getting a dry mouth? So when there is a dry mouth, what happens that there is no saliva. So when there is no saliva, what happens? You get multiple disease. You get gum disease. Next thing is attrition. That means your enamel wears off. You can see a clinical picture. You can see the clinical picture where the enamel wears off. The tooth which appears long enough, you will start feeling that your teeth are looking short. They look tiny because the enamel is worn out. You can see in the picture, and you can see a post-operative picture where we give you crowns to give you a proper occlusion. You can have a proper set of teeth. So this is what happens with aging. And as the age progresses, the enamel gets worn off and your teeth looks shorter, and this is what is called as the attrition of teeth. Your teeth appears like this. So what happens? You start getting sensitivity. So here you complain of sensitivity. You say the moment I have cold, I get bad sensitivity. The moment I have something hot, I get sensitivity. Some people are sensitive to cold, some people are sensitive to tea, some people are sensitive to sweet. It depends upon person to person perception. The sensitivity varies, and then sometimes it becomes anxious for you. You get a lot of anxiety. Sometimes it becomes a social embarrassment where you are not able to have an ice cream or dessert, even though you enjoy the full sumptuous meal, but then you come to have a dessert, you feel a lot of sensitivity and you avoid having it. Why do you have to avoid? Because you have a mindset that no, because I'm aging, this is normal. Yes, it is normal, but there are treatments for it. We can definitely help you to avoid sensitivity. We could help you to resolve sensitivity. So we are always there to guide you and help you. So I'm always there. So you have to consider that everything is physiological, but they are modes of prevention and they are modes of treatment for that. That is what is attrition. This is what is happening, abrefaction or abrasion. When you do a very hard brush, you take a hard brush or a medium brush, brush it very hard, so that you feel that if I'm brushing for 10 minutes, no need to go to a dentist because I'm brushing so hard, I'm removing such a nice plaque that I can avoid it. No. The more harder you brush, the more complicated it becomes because you start losing your tooth structure. The enamel is lost. So that is what is the most important. My audio is not clear?
Yeah, Dr. Ashank, it keeps going in and out, like you're moving away from wherever the source of the audio is. Do you have a mic that is moving maybe, or?
Okay, one second. I'll look into it.
Thank you.
Now, am I audible clear?
Yeah, can you say something more just to...
Yeah, am I audible now? Am I clear?
Yeah, it's clear for me now.
Okay. So this is what happens in abrefaction, where there will be a lot of loss of the enamel, and then what happens basically is you lose the enamel and you start getting such notches on your teeth. If you can see the clinical picture there. If I'm not audible, please let me know.
No, we are hearing, we can hear you now.
You can hear it now? Okay. No. That's great. Okay. So now what happens?
Something just changed again.
This is what happens actually when you have a lot of carbonated drinks, lot of citrus food. So what happens is you feel that enamel wears off and you start getting sensitivity, which is sometimes seen and sometimes it is not seen, which happens in the inside surface of your teeth. So this is what is erosions. This is what I'm telling you, dental caries, which is the decay of the teeth, which happens because of lack of saliva, because your mouth is dry, or you even feel that your saliva is very thick, because what happens, there is no moisturization in your mouth. That is why we advise you to keep having a lot of water. Don't be dehydrated. That is the most important thing to be considered. That dehydration is a big problem. And in summers, we have to make sure that it is like that. So maybe it is already in that way. And now we have to make sure that there are multiple decays which happens. You see longitudinal cracks, which you see on the teeth as aging processes. You see yellowishness. This is also one of the very important things which people have a myth about, that why are my teeth becoming yellow? See, it is physiological. Now what happens is your enamel is white. So as the age progresses, you lose the enamel. So the inner surface of the tooth, which is dentine, starts appearing. So you slightly start getting yellowish tinge on your teeth, and which is natural. And there is no need to do any treatment for that yellowishness, because that is absolute physiological process of aging on the tooth surface. On the tongue surface, as I said, you have a lot of papillas because you have a lot of taste sensations, and as age increases, as I said, the fissures will increase on the tongue. Dryness of mouth increases. Taste buds, you lose some taste buds, and what happens is there's a lot of, this is what you see, which is called as the caviar tongue. When you see a lot of blood vessel proliferation in your, when you raise your tongue, you can see, which is normal again. This is also physiological, which happens with aging. This is not a pathology, so don't worry about it. So this is what are the changes what you observe on the tongue surface. Saliva, as I said, salivary flow decreases. There will be a lots of decrease of saliva, and what happens when saliva decreases, which is basically because of some of the drugs, you get lubrication problem, moisturization is not there, caries happen. You may notice that you are getting bad breath, you are getting a lot of decay, lot of gum disease, and you know gum disease means it starts with bleeding gums. So this is all because of saliva. For this also we have a treatment. For this also we have a lot of treatment. First we take your drug history, we try to know whether any drug is causing you a problem with saliva. We give you artificial saliva. There is something called as salivary substitutes, something for lubricating your mouth, if you're not aware of. There's a lot of things which I could advise you in these things, that if someone is facing these problems, there are a lot of people who also face, I should say, burning mouth, like you feel a lot of burning in your mouth, which happens basically in females after menopause, and even and in males, because a lot of stress and anxiety, you feel burning in the mouth, you feel that you can't eat any spicy food. So even that is also one of the complications which happens because of lack of saliva. For that also we have treatments, we have some recommended mouthwashes which I could help you with. So anyone suffering with those things also, definitely you can approach me for that. Now, what are the changes in the motor function? There will be difficulty because all your tissues, all your muscles start getting atrophied, start getting weaker. So what happens is there will be difficulty in chewing because the muscles are weak. There will be difficulty in swallowing, speech. So these things will happen. Most importantly, as I said, there are age changes in the jaw bones. So what happens is your jaw bones, you see changes, you see change in your palate. Palate is the bone, what is there, what is the above, what we call the roof of your mouth. So there will be changes in the dimensions of that. And there will be, that is something which happens a lot in the palate. And what happens is the palate changes because there are a lot of taste buds on your palate also. There are glands on the palate also. So even those things show changes. Your mandible and your maxilla. Your maxilla means your upper jawbone, and your mandible means your lower jawbone. So what you can notice is there are a lot of changes in the jaw bones. There are changes in the joint. Like you all know very well that what happens is the most common thing is arthritis. What is arthritis? Arthritis is inflammation of your joints, which happens which starts with your knee joint, which goes to your elbow joint, small joints. So how can you forget that there's a joint in your head also, which is called the temporomandibular joint, the joint which is present here. So even that joint starts getting changes, starts getting degenerative changes. You get arthritis of the joint where you have difficulty in opening. You say, I'm getting pain when I'm opening the mouth, and I may get pain on right or left or both. So there are a lot of changes in the joint also which happens. So we need to rule out the arthritis of the joints, because of which the muscles become problems. So it's difficult in opening the mouth, difficulty in chewing, difficulty in swallowing. So these things are also affected with that. So what is, as I said before in my presentation, that we preferably focus on preventive dental care. So what is the problem in the preventive dental care? Most of you all have a wrong opinion that the tooth loss is aging process and we cannot prevent it. As I said before, tooth loss is aging process, but it cannot be prevented is not true. Okay, it is an aging process, but then it can be prevented, it can be treated. So whenever, and don't get adapted to the compromised status of the mouth. So there's a tooth loss, you lost the tooth, you say, but it's aging. Okay, fine, I'm 55, I lost the tooth. Why do you think that? Because 55 is also young, 65 is also young. There is no end to aging. So if whatever age or whatever life we all have, we should make sure that we eat properly, we chew properly, and we should go for a rehabilitation of the teeth. Loss of teeth is preventable, we can manage. Replacement of the teeth is also there, and it is mandatory. As I said, When there is no replacement of the tooth, there are a lot of changes which happens in your mouth, which are going to affect you in the later part of your life. Lastly, the concept of preventive dentistry was not there when most of you all were young. So now what happens is the preventive dentistry has become a very young concept. Even we advise for even 3 years child also. So preventive dentistry is an aspect which we advise to all the walks of life. And we make sure that preventive dentistry has to be considered so that we can help every one of you. So please remove that from your opinion about that aging is there and things like that. Aging is there, but you can never say that because you are aging, you don't need teeth. You need teeth. You have a right to have teeth. You have a right to have chewing efficiency, swallowing food properly, enjoying the food, having a good taste, and you need to understand everything about it. And we are always there to help you and guide you at considering your medical status, mind you, considering your medical status. So please look into it and try to understand these tips which I am giving you to all of you. You start using electric brushes or electric flossers. If you are not able to do manually because there is a manual dexterity or you are not able to handle it, I am there to guide you. We'll be able to manage and help you, to advise you which one to take, how to use it, instructions to use it, where to use it, water pick, as I mentioned in previous sessions also, remineralizing toothpaste, because your teeth, you have lost enamel. So you need to maintain the tooth. So we try to remineralize by giving you fluoride toothpaste, fluoride mouth rinses, proper denture care, how to remove the denture, how to place the denture, how to clean the denture, how to maintain your denture, and something called as TSD, tell, show, and do. What I tell you, I will show you, then you will do it. This is the concept, where it is just not going on telling. We will practically, whatever I am telling you, I will show it to you. I will demonstrate to you, either on some other individuals so that you learn from that, or maybe to you itself so that you will understand tell, show, do technique, which we do it even for children so that they understand how to use. Because you have been, I'm sure all of them are using brushing, all of them are using flossing, but then as the age increases, it is becoming cumbersome for you because of health reasons. So we are there to modify it accordingly, customize it. I would help you to customize it so that you can use all the oral hygiene products and oral hygiene routine so that these things become adaptable for you and you can acclimatize to them very, very comfortably at ease. So the most common thing I would like to talk about is arthritis. So with arthritis, what happens is it becomes very difficult for you to hold the brush tightly, to brush, to change the side, to move, and all those things. So for arthritis, that's what I'm telling you. You can modify to electric brushes where your manual pressure is not much needed. The brush itself does it. So we have got powered brushes. We have got various companies which are giving it in the market. So don't go and purchase over the counter what is available. What is ideal for you? There are a variety available. There's a lot of confusion, a lot of dilemma when you go and purchase it. So anyone needs an advice for it, you can count on me. I can help you out with that. This is something, this is not to intimidate any one of you present out here. Oral cancer is something which happens because during the age, people who have got habit of smoking, betel nut chewing, pan chewing, or what we say in India, supadi also, those people, and it is not only habits, mind you. Oral cancer also happens sometimes when you have a sharp tooth. You may be surprised or you may be bewildered knowing that even a sharp tooth for which you may be lethargic to go to a dentist, that it's okay, it's physiological, again, same thing. But that causes irritation to your tongue and that can lead to tongue cancer. The first picture which I'm showing you on a screen, you can see a ulcer on the tongue which happens because of a sharp tooth or a wrong bridge or a denture which is poking, chronic poking. So please make sure that any ulcer or any lesion in your mouth more than 3 weeks, non-healing, you have to go for an advice of a dentist or a physician, or you need to go for an intervention because we need to rule out what exactly it is. So I'm showing you on the lip because a lot of UV radiation exposure, thin skin, your fair skin people can get a lot of exposure of the UV, lip, tongue, jaws, cheek. It is not only for the people who have habits, but also for the people who have got improper dentures, improper crowns, sharp tooth, poking tooth. Please make sure that you get an advice and you get them corrected because on chronic irritation, chronic lesions, long time bearing it, it may turn into pre-cancer or maybe a cancer also. Because as age increases, you have less immunity, you have a lot of other things which happens in your mouth which are changing, and you need to make sure that this evaluation has to be done by the dentist, and we need to give you a preventive options if something like this is there, so that we can correct it at a very initial stage, or maybe at a risk factor stage itself, that you have something like this and we can help you out with that. So please, this is nothing to intimidate any one of you. It is purely for education purpose, my perspective of showing these pictures, and to make you all to understand what is the significance of even having a sharp tooth in your mouth, or a poking denture, or a poking bridge, or an irritating filling which is hanging around and you are not getting it treated. So please make sure and definitely ponder about these points which I have mentioned just now to you. We have an oral cancer awareness month the next month, April, where we'll be conducting some oral health or oral cancer screening. So I will be there to help. So you can definitely visit, and I could screen if anything is there, so that we can prevent not only oral cancer, but if there is something which is having a risk to turn into that, we could help you to at least eliminate that, that you can have a healthy and a happier life. So this is the second session of the presentation, where we move on to the oral changes in diabetes, because that is most common today, highly prevalent disease. And you all know that diabetes and oral health is very, very, very important, because diabetes and oral health goes side by side. When there's diabetes, you have a bad oral health. When there's a bad oral health, it leads to diabetes. You will have to understand that the World Health Organization, WHO, and American Diabetic Association has accepted gum disease as the sixth complication of diabetes. So as important is your eye, your kidney, your nerves, as important, the same important is your gums also. And diabetes individuals should go for preventive gum therapies, and they have to evaluate their gums and go for gum therapies. Diabetes individuals have 3 times more risk of getting gum disease, and gum disease can lead to high sugar. It is not only because you have high sugar, you have gum disease. Because you have gum disease, you may have higher sugar levels, or vice versa. This is something which I want you to understand. It is a two-way street. It is a double-edged sword. Both of them are equally important. Both of them will lead to important effects on each other. And this is a cycle of a gum disease and diabetes, which all of you should take care of. And mind you, it is always important to get a screening of gum disease done, get a preventive gum therapy done, and understand. Then nowadays, we have got a lot of laser assisted therapies, which are preventive aspects, which are done in Western countries. And we could also do it and start those therapies. And there are therapies which are done, and we could help you to prevent the gum disease. Because what happens with gum disease and diabetes, same thing happens. A lot of tartar, you get root caries. That means the decay happens in the root. Now, as you can see in the picture, that the gums are receding and their cavities are seen on the root. So you get absolute sensitivity. You see black discoloration of the tooth, you get sensitivity, and there is no management for root caries. Whenever there is a decay in the root, we only advise you for extraction, because we don't treat root caries. So don't wait for the stage for the decay to go to the root level, where we cannot help you out with. You can see a picture here. You can see multiple decays. You can see white lesions. You can see lesions in your mouth, multiple fillings. This is what is the common patient's mouth, and this is what happens. And you have to get these things done, treated at a very early stage. Diabetes individuals will have a lot of gum enlargement. You can see a lot of gum enlargement, poor hygiene. You can see the picture. You can see so much of tartar. These enlargements are sometimes because of some drugs, because of poor oral hygiene, not getting the cleaning done, not feeling to go to a dentist for getting a checkup done, because you feel again that it is not necessary, or because you have already so many medical problems that if I get this done, I may land up into some other problem. No, we are there to take care of it. There are protocols. I would consider these medical conditions and do a management. That is where comes the role of lasers in dentistry, where we avoid giving you a lot of, problems like pain or bleeding, and we do less or minimally invasive managements with laser, so that we can help your gums to get corrected, so that you can save your teeth for a more longer period of time. And I would advise to save your teeth than going for replacement, because what you have and natural is always best, because natural teeth has proprioception. You feel the pressure of what you're biting. You enjoy the taste. So it's always better to save your natural teeth, that you have all the senses of your teeth, all the tastes, proprioception, pain feeling, everything is active, and you can relish what you are actually eating. Burning mouth syndrome, as I said, you get lesions on your tongue. because of your dry mouth. You get burning mouth. You get burning mouth sometimes with spicy food, or sometimes with normal food itself. You can't even have water. And don't wait for this to come out, because then we have to start up with some steroid therapies. And to avoid all those things, there are other management aspects which are there for burning mouth syndrome also. As I said, dry mouth and fissured tongue, which happens with aging, similarly happens with diabetes. Candidiasis happens with diabetes. It's a fungal infection. You see white, it is like cottage cheese, something like cottage cheese or curdled you want to see in your mouth. You can scrape the white lesion on your mouth. Dentures. This is what I mentioned to you when I was speaking to you regarding dentures. If you don't remove your denture, don't clean your dentures, what happens? Inside you see fungal infection in your mouth. So we need to correct those dentures also. We need to make sure that dentures are cleaned. Your mouth, you have to evaluate. The caregivers, the role of caregivers come here. Maybe you yourself can see in the mirror, open your mouth wide and see whether you have any white lesions, any red lesions, anything which you can scrape out. Then this is something, a source of fungal infection. We need to manage this also. So please look into these findings also in your mouth. And diabetes individuals, yes, because immunity is compromised, healing is delayed, opportunistic bacteria and fungus will attack frequently. So you all have to be very careful with these things. Multiple ulcers. And most important thing, one of the most important thing where we as a periodontist, as a gum specialist, screen diabetes, like you have got multiple abscess. You know what abscess is? Abscess means accumulation of pus. You can see in the picture. You can see 4 or 5 places the patient has so much of pus inside. So when there's a multiple pus, patient comes to us and says, I'm fine, but I have no problem. When we send for sugar evaluation, patient turns out to be diabetic positive. So this is the first sign what you see in the gums when a patient is non-diabetic, and we screen the patient and then we come to know the patient is diabetic. So there are a lot of changes in the mouth which will give us an idea that the patient is diabetic, which could be a multiple abscess, multiple pus in your gums, bleeding gums spontaneously, without touching the gums only. Next day morning you get up and you see bleeding in your gums, those things. So please notice these things and please make sure that these are what the body is giving us. See, please understand that the oral cavity or your mouth is a mirror of your body. Whatever is happening in your body, the body reflects through your mouth. And we, as a dentist, as a periodontist, look into that and can give you an idea that these are the risk factors which are involved into you and you have to consider them. So the reflection of your body is in your mouth, and oral health is equal to your overall health. So whatever it is, elderly individuals, diabetic individuals, medically compromised individuals, or even youngsters nowadays, all of them have to make sure that these things are very, very important to be considered. So this is what I would like to conclude by saying that all of you, please take care of your health. Consider oral health as one of the important aspects of your overall health. Go for regular checkups to a dentist. The dentist will decide what type of compliance you belong to, what type of supportive category you belong to, whether you must come every 3 months, whether you must come every 6 months, 1 year. We will categorize you, we will help you. And what I will do individually is, as a gum specialist, we have a preventive aspects of this. We call you, make you compliant so that you come to us. We correct your gums properly, we correct your teeth, we'll tell you the regimens to be followed, oral health regimens, what floss, what mouthwash, how to use. Maybe you can help your guide your caregivers to do it. And this is how I could help you and contribute to all the members of DOBARA and all the members who are attending the presentation today. And my setup is at Dentalodontics, which is at Himayat Nagar, Hyderabad. These are my social handles you can follow. You can get a lot of awareness. And I would be always there to guide you, to help everyone, so that all of them can maintain a good oral hygiene, a good oral health, and all of you keep smiling. So thank you so much. I'm there for the discussion, open discussion now. I hope it was clear, and I made it crisp and clear, because of the 2 sessions previously, if people have missed out, they could look into that, and it could be some repetition. So I just concised it to a few of the important aspects and highlights for that. So let me know if anything is there. I'm open. Whatever questions are parked for me, I'm there.
There's in the chat, there's brilliant presentation. You were amazingly clear. Thank you very much.
Thank you. Thank you.
Does anybody who's here with us on Zoom, would you like to ask questions? Any? Oh, yeah, sorry. Yeah. Go ahead, Mom.
Dr. Ashank?
Yeah, ma'am.
My question to you is, if your gums are receding,
Yes.
and especially the front 2-3 teeth, the lower jawline, is there some technique where you can pull the gum up, or you learn to live with it?
A very good question. I really appreciate. That is something very common which you will find. But yes, there is no, we can't pull the gum up because gum disease is irreversible. Once it is, gum disease is something which is irreversible. You lose the gum, you lose the bone, you lost it forever. But when you come to an early stage, when it happened just minute, we would have prevented it. But once the recession has happened long and your tooth start appearing long, we can prevent it to become more worse. We can't pull them up, but we can make them in such a way that they don't go further down and you lose your teeth. So there is a separate brushing technique for those type of teeth itself. What you do overall brushing technique is different. What you do for those 4 teeth which are having receding gums is entirely different, which is called as, there's a different technique for that, which we advise for those teeth whose gums are receding and you want to prevent them to further recede. Because what is the consequence or a sequelae of receding gum? Sensitivity. Sensitivity, getting decay in those areas. Appearance definitely, but then because it is lower, appearance doesn't matter much. But it happens unfortunately on the upper teeth. The moment you smile, you see that the gums are, your teeth start appearing longer enough. So in those cases, we can also do some fillings sometimes if you want. Fillings can be done, but we cannot pull back your gums. I hope I'm clear.
Fillings of gum.
Fillings on the roots,
Oh.
on those roots where gums have receded, fillings because you have sensitivity. If you have sensitivity, we do the filling so that we cover the enamel so that you will not have an extreme sensitivity. So fillings are done to avoid sensitivity, and brushing technique is advised to you so that you avoid the receding of the gums of the adjacent teeth. Because eventually what happens, all the gums start receding, then it becomes uncontrollable. So that is why every 3 months to 6 months, you have to go for dental cleaning, evaluation, so that this should not happen, because the remaining set of 28 teeth or whatever teeth remaining in the mouth have to be prevented.
And then you also mentioned in one of your lectures, Dr. Ashank, that overbrushing is not good, etc. But how important, or like, we go out for dinners, we go out for parties, and nobody's taking notice of really gargling your mouth thoroughly after. Maybe you might go home and do it or forget it. So immediately after food, what would you advise?
I'm not able to understand. Not able to. 1 second, man.
I can ask. Immediately after eating, what do you advise to keep the mouth clean? Whether it's a gargle.
Yes. That is good. Yeah. So immediately after eating, definitely when you're outside, we can't expect you to brush. Brushing is advised only 2 times. That's all. Wherever you are, you eat 10 times in a day also, no problem. Brushing is only twice and only 2 minutes. Brushing not more than 2 minutes. This is ideal. Whenever you are eating outside, whatever it is, snacking, or you're having a dinner outside, or a dessert especially, at least rinse with the normal water. At least rinse. Because it will grossly flush off whatever is stuck between your teeth. After going home, you can brush. You're going to brush after going home in the last. But if you're eating something, make sure that you at least gargle. No need for adding any warm water. No need for any salt. Just a normal rinse for 30 seconds in your mouth will flush off. Plus, it will also lubricate your mouth. As I said, dryness will be there. It lubricates your mouth. So when it lubricates your mouth, it also in fact promotes your saliva to be there so that the flushing automatically happens. There should be moisture in the mouth. It will not attack because the bacteria are waiting to do party in your mouth. Bacteria are there in your mouth. They are just waiting. You eat something, you don't rinse, they come out and they will start doing party because they want carbs, they want starch, they want to utilize it, convert into acid, you start getting decay. So bacteria is waiting inside. Everyone has the bacteria inside. Only thing is the moment you don't rinse or you don't brush, even not only for elderly individuals, but for children also same thing. Because they eat lot of confectionery goods, lot of chocolates. You need to rinse at least so that these sticky substances are not the food for the bacteria.
Welcome.
Okay.
Thank you, Dr. Ashank.
We have Chidambara with the question, Dr. Ashank.
Yeah, yeah.
Not one, I have got 3 questions, sir. Dr. Ashank, where is your clinic in Hyderabad? First thing. Second thing, and do you have any facility for holding a OP camp for, I'm president of a senior citizens association. Have you got any facility to hold a OP, what you call section for examining the
Yes.
old people at our office for some time?
My voice is audible, sir?
Yeah, your voice is quite audible.
I'm audible. Okay. First of all, welcome to my 3rd session. I'm very glad and honored that you are present today with us. Thank you very much. And secondly, your question, what you asked me. Yes, my clinic is at Hyderabad, at Himayat Nagar area. And third thing is, I would be glad to have an OP checkup for the individuals, or for you are a senior citizen organization. So for all the senior citizens, if you want them to come to my setup, we can plan schedule wise and we can do it. Or if you have all the people gathered at one place, I would personally come with my team and evaluate all the patients. I have no problem with that.
This is what I am asking for, because unless the people come to know that they have got a problem first, they will not be able to go and meet you.
Definitely, definitely. I would share my contact details with you. I will talk to you after this, and then we can have a collaboration where I myself can come to you, or you can send all of them here, and we can have a whole checkup screening, and I will write down all the problems individual to the patient or individual. Then you can decide or take a call about the dental treatment. I'll be most honored to do that. No problem.
Yeah.
I will share the information with you.
My last question is, thank you very much. My last question is, I have got multiple RTCs, RCTs, multiple RCTs, and some of the teeth where there is RCT capping, they are decaying in the middle of the below the RC cap, and they are crumbling. Already one tooth I have lost, and others are on the way. So I would like to know whether something can be done about it to prevent.
Yes, definitely something can be done. Something should be done actually. You have undergone root canal treatment, you have undergone capping, still you are facing. That means I would advise you that we will have a thorough checkup, and then whatever teeth we can try, because after doing root canal and capping, we have to save your teeth because you have undergone so much of treatment on that tooth. Eventually you wanted to save that tooth. So we will try to clean that area and try to see if we can do some cementing in that, and we save the tooth. And second most important thing, I would help you to clean that area by yourself so that this should not happen in the other teeth. How to clean interdentally? I would advise you a customized brushes so that you can maintain them well. So no issue on that. I am always there to guide you.
Good. If you don't mind, one more this thing.
Yes, most welcome.
You said the bacteria inside the mouth will cause other diseases. I'm having serious, rather chronic throat infection and expectoration from the laryngeal area.
Okay. You have COPD.
4 5 years, and sneezing and a lot of nasal running.
Yes.
Anything with this could be?
Yes. If you really, if I once I check, I can let you know. Because if you have a lot of gum infection, and as you are saying, there's a lot of decay, that means there's a lot of gum infection. These bacteria contribute to your upper respiratory infection diseases. The bacteria contributes to it. So definitely from the mouth, the bacteria can go there. And if you have upper respiratory infections also, bacteria, because suppuration, as you are saying, a lot of sneezing, a lot of expectoration, these things definitely have to be considered. So I think once I will definitely meet you, look into it, and then advise you what best I can do for you, sir. No problem. No worries about it.
So phone number is here. I will note it down and then I'll see.
Sure, definitely, sir, definitely.
Okay. I'll be in contact with you.
Yeah, for sure, sir.
Okay, thank you.
Most welcome, sir. Good evening.
Thank you so much, Dr. Ashank. As and when, if anyone else comes up with questions, we will send them your way, and we'll be doing our camp with DOBARA and with Mr. Chidambara Mock, which means you're going to be helping a lot of people. That's going to be amazing.
Yeah, sure. Most welcome. I hope things may clear.
Post his phone number on the mail.
I'll email everything to you, Uncle Chidambara. Don't worry.
Thank you very much.
All right. Well, thank you, Dr. Ashank. What we're going to do is we're going to put all this information, we're going to share the 3 videos along with your practice and how to contact you on our website so that everyone has that information as well and can always look back at the videos if they
definitely. They can look back at the video. Maybe we again take up some other topic after a couple of months, and then maybe we revise few things. Maybe people can, after the videos, maybe people may gather a little more doubts. And once the doubts are more accumulated, we can have one more session answering Q&A for everything. That also would be helpful. So it's always there. I think I'm part of DOBARA, so
Amina.
Yes, Mr. Dambara.
Samin Kanya, my greetings to Mother Amina.
I will. She's right here. She's next to you on the screen, Uncle Chidambara. Thank you so much.
No, I could not see. I didn't see.
I'm going to sign out. Thank you, everyone.
Okay, bye-bye. Yeah.
Bye.
Take care. Take care. Keep smiling, all of you.